Your liver is being destroyed right now, and you probably don't even know it. That pill you just popped, it's taking a direct hit at your most important detox organ. Every year, over 2,000 Americans experience acute liver failure, and half of those cases come from something sitting in your medicine cabinet. Here's what your doctor won't tell you. There are 10 common medications that are absolute liver killers, and most people have no idea until it's too late. I've spent years researching liver toxicity, and today, I'm breaking down the medications most likely to land you in the transplant. By the end of this video, you'll know exactly which pills to question and the warning signs your liver is waving before it's too late. You might think you're taking medicine to get better, but what if that same medicine is silently destroying your most vital organ? Before we dive into these dangerous medications, you need to understand what your liver actually does. It's not just some random organ sitting there. It's literally your body's chemical processing plant. Every single thing you consume, food, drinks, medications, supplements, has to pass through your liver. Think of it as your body's bouncer, deciding what gets to stay and what needs to be kicked out. The scary part? Unlike your kidneys, there's no machine that can take over when your liver fails. Once it shuts down, you're in serious trouble. Hemodialysis can replace kidney function, but for the liver, you either recover or you need a new one. Your liver is constantly filtering toxins from your bloodstream, breaking down medications into usable forms, producing essential proteins, storing vitamins, and regulating your metabolism. It's doing hundreds of jobs simultaneously, 24/7, without a break. And here's what's wild. Your liver is processing over 500 different functions right now as you're watching this. It's the ultimate multitasker in your body. But when medications damage your liver cells, this incredible organ starts to fail. And the truly terrifying part, you might not notice until it's already severely damaged. So how do you know if your liver is in trouble? Let's talk symptoms. Your liver doesn't just suddenly fail one day without warning. It actually sends out distress signals, but most people miss them or confuse them with other issues. The first signs that medications are damaging your liver include unexplained fatigue that doesn't improve with rest, nausea that comes and goes throughout the day, abdominal pain, especially on your right side under your ribs, dark urine, we're talking iced tea or cola colored, pale clay-colored stool that looks drastically different than normal, jaundice, when your skin and the whites of your eyes turn yellow, itching all over your body for no apparent reason, swelling in your legs and ankles from fluid retention. But here's the catch. These symptoms don't typically show up right away. Medication-induced liver damage can take anywhere from 5 days to 3 months to appear after you start taking a drug. And by then, significant damage might already be done. What's even more concerning is that liver damage doesn't follow the same timeline for everyone. Your age, existing liver health, alcohol consumption, and even genetics all play roles in how quickly and severely your liver reacts to toxic medication. Now, before I reveal the 10 worst offenders, I need to make something crystal clear. I'm not telling you to stop taking your prescribed medications. Many of these drugs save lives when used correctly. This information is about awareness, not about stopping necessary treatment. Always talk to your doctor before making any changes to your medication regimen. Let's count down the 10 medications most likely to destroy your liver. Number 10, diclofenac, the anti-inflammatory time bomb. Most people think nothing of popping an anti-inflammatory when pain strikes. But not all NSAIDs are created equal when it comes to liver safety. Diclofenac stands out as the anti-inflammatory with the highest risk of causing liver injuries. While drugs like ibuprofen and naproxen can also potentially harm your liver, diclofenac is in a league of its own. What makes diclofenac particularly dangerous is that the damage often appears weeks or even months after you start taking it. By the time you notice symptoms, your liver might already be seriously compromised. Think about it. Millions of people take diclofenac regularly for arthritis, back pain, and other chronic conditions. They assume it's relatively safe because it's so common, but the reality is quite different. Research has shown that diclofenac users have a 3.7 times higher risk of liver injury compared to people not taking any NSAIDs. And unlike kidney damage, which gets more attention with these drugs, liver damage can be harder to detect early. The next time you reach for that diclofenac pill, remember that your liver is processing every milligram. Consider asking your doctor about safer alternatives if you need long-term pain management. But if you thought diclofenac was concerning, wait until you hear about our next medication. Number 9, amoxicillin plus clavulin, the double-edged antibiotic. When you have a bad sinus infection or bronchitis, your doctor might prescribe amoxicillin with clavulin, commonly known as Augmentin. It's one of the most frequently prescribed antibiotics worldwide. This combination antibiotic is incredibly effective at fighting bacterial infection. The amoxicillin kills bacteria, while the clavulanate prevents bacteria from becoming resistant. Sounds perfect in theory, but here's what most doctors don't emphasize enough. This antibiotic cocktail has been linked to hundreds of cases of acute liver injury. In fact, it's one of the most common causes of drug-induced liver damage in many countries. The risk is highest for people over 65, but it can happen to anyone. What's particularly sneaky about this medication is that liver problems typically show up after finished your course of antibiotics, usually 1 to 3 weeks later, when you're no longer even thinking about the medication. By then, you might not connect your symptoms to an antibiotic you took weeks ago. You might blame food poisoning or a stomach bug for your nausea and abdominal pain, all while your liver is struggling. Studies show that about 1 in 2,500 patients taking this antibiotic will develop liver injury. That might not sound like a lot, but with millions of prescriptions written annually, that adds up to thousands of cases. If you've been prescribed this antibiotic combination, be particularly vigilant about monitoring for liver symptoms in the weeks following treatment. But as dangerous as antibiotics can be, they don't hold a candle to our next liver destroyer. Number 8, amiodarone, the heart saver that attacks your liver. If you have a serious heart rhythm problem, your cardiologist might prescribe amiodarone, also sold as cordarone or pacerone. This powerful medication can literally be life-saving for people with severe arrhythmias. Amiodarone is extraordinarily effective at controlling irregular heartbeats. It works so well that it can completely normalize 24-hour heart rhythm monitors in patients who previously showed dangerous patterns. But that effectiveness comes with a serious price tag for liver. What makes amiodarone particularly dangerous is its long half-life. This medication stays in your system for up to 100 days after you stop taking it. That means it's continuously processed by your liver for months. Unlike some medications that cause immediate, acute damage, amiodarone typically causes cumulative harm over time. It slowly builds up in your liver cells, eventually causing inflammation and injury. The risk increases dramatically with long-term use. After 1 to 2 years on amiodarone, up to 15 to 20% of patients will show evidence of liver damage on blood tests. Even more concerning is that amiodarone doesn't just affect your liver, it's notorious for causing problems in multiple organs, including your thyroid, lungs, and eyes. It's so potent that doctors now use it much more selectively than they did in the past. If you're on amiodarone, your doctor should be checking your liver function regularly. But don't just rely on those tests. Stay alert for any signs that your liver might be struggling. And speaking of medications that build up in your system, number 7, allopurinol, the gout treatment that gambles with your liver. If you're one of the millions of people suffering from gout or high uric acid levels, your doctor has likely prescribed allopurinol. This medication effectively reduces uric acid in your blood, preventing those agonizing gout attacks. For most people, allopurinol works safely for years, but for an unlucky few, this medication can trigger severe liver damage, and it can happen with shocking speed. Unlike some medications that take months to harm your liver, allopurinol can cause injury within days or weeks of starting treatment. This rapid onset makes it particularly dangerous, as the damage can escalate quickly if you don't recognize the symptom. What's especially concerning about allopurinol is that the liver reaction often comes with other serious symptoms: fever, rash, and eosinophilia, elevated white blood cells. This combination, known as DRESS syndrome, drug reaction with eosinophilia and systemic symptoms, can be life-threatening. Studies show that patients of Asian descent, particularly those with a specific genetic marker called HLA-B5801, are at much higher risk for these severe reactions. This is why genetic testing before starting allopurinol is becoming more common in some countries. Despite these risks, allopurinol remains a crucial medication for many people with chronic gout. The key is careful monitoring, especially during the first few months of treatment. But as concerning as allopurinol can be, our next category of medications affects even more people. Number 6, anticonvulsants. Seizure control at a liver cost. For people with epilepsy or certain psychiatric conditions, anticonvulsant medications can be life-changing. Drugs like phenytoin, Dilantin, valproic acid, Depakote, carbamazepine, Tegretol, and lamotrigine, Lamictal help control seizures and stabilize mood. But these brain-saving medications can be devastating to your liver. Phenytoin can begin damaging the liver almost immediately after starting treatment. The injury typically appears as an allergic-type reaction, fever, rash, and rapid elevation of liver enzymes. Valproic acid presents an even more serious threat, especially in children under 2 years old, people with metabolic disorders, and those with existing liver problems. The damage usually begins 1 to 6 weeks after starting treatment. What makes these medications particularly problematic is that patients often can't simply stop taking them, even if liver damage is detected. Stopping an anticonvulsant abruptly can trigger life-threatening seizures. The risk is highest during the first 6 months of treatment, which is why doctors typically monitor liver function closely during this period. About 1 in 50,000 patients taking these medications will develop severe, potentially fatal liver injury. If you're on any anticonvulsant, be particularly vigilant about symptoms like unusual fatigue, loss of appetite, nausea, or yellowing of the skin. Early detection is crucial for preventing permanent liver damage. But if you thought seizure medications were harsh on your liver, wait until you hear about number 5 on our list. Number 5. Methotrexate, the double agent in your medicine cabinet. Methotrexate is one of medicine's most versatile drugs. It treats rheumatoid arthritis, psoriasis, inflammatory bowel disease, and certain cancer. For many people with autoimmune conditions, it's been nothing short of miraculous. But this same medication that helps millions also ranks among the most notorious liver damagers in the pharmacy. What makes methotrexate unique is that it can cause 2 distinct types of liver injury. The first is a temporary elevation in liver enzymes that affects up to 30% of patients taking the drug. This usually resolves with dose adjustment or a brief pause in treatment. The second, more concerning type is fibrosis, the gradual scarring of liver tissue, which can eventually lead to cirrhosis if the medication is continued for years without proper monitoring. The risk increases dramatically with higher doses, longer duration of use, obesity, diabetes, alcohol consumption, age over 70. This is why patients on methotrexate typically undergo regular liver function tests and occasionally liver biopsies to check for early signs of fibrosis. Perhaps most concerning is that the damage from methotrexate can be silent for years. You might feel perfectly fine while your liver is slowly scarring, only discovering the problem when it's advanced. If you're taking methotrexate, especially for a chronic condition like rheumatoid arthritis or psoriasis, make sure you never miss those monitoring appointments. They could literally save your liver. But methotrexate isn't the only medication that silently damages your liver. Number 4. Antifungals, fighting fungus. While attacking your liver, fungal infections can be stubborn and difficult to treat. When topical treatments fail, doctors often prescribe oral antifungals like fluconazole, diflucan, or itraconazole, Sporanox. These medications are highly effective against everything from common yeast infections to stubborn toenail fungus. But that effectiveness comes with a significant risk to your liver. Among antifungals, ketoconazole was once the most notoriously liver toxic, leading to its restricted use in many countries. But even the newer, supposedly safer options like fluconazole and itraconazole carry substantial risks. What makes antifungals particularly problematic is that the treatment courses are often long, weeks to months, giving them plenty of time to damage liver cells. Toenail fungus treatments, for instance, typically last 3 to 6 months. During this extended treatment, the antifungal medication is continuously processed by your liver, slowly accumulating and potentially causing inflammation and cell death. The liver injury from antifungals typically appears within the first 6 weeks of treatment and can range from mild enzyme elevations to catastrophic liver failure requiring transplantation. Studies show that about 1 to 2% of patients taking oral antifungals will develop significant liver enzyme abnormalities. While that percentage may seem small, it translates to thousands of cases each year. If you're prescribed an oral antifungal, especially for a non-serious condition like toenail fungus, it's worth discussing the liver risks with your doctor and considering whether the cosmetic benefit is worth the potential harm. But as risky as antifungals can be, they're not as widely used as our next liver-damaging medication. Number 3. Methyl-dopa, the blood pressure drug with a dark side. Methyl-dopa is an older blood pressure medication that's less commonly used today for most patients. However, it remains one of the safest options for treating hypertension during pregnancy, when many newer medications can harm the developing baby. Despite its relative safety for the fetus, methyl-dopa carries significant risks for the mother's liver. This medication can cause liver injury in 2 distinct ways. The first is an acute hepatitis-like reaction that typically occurs within 1 to 4 weeks of starting treatment. This type affects about 1 in 1,000 patients. The second, much rarer but more serious reaction is chronic active hepatitis, which can develop after months or even years of methyl-dopa use. This type of injury can progress to cirrhosis if the medication isn't stopped. What makes methyl-dopa particularly concerning is that the liver damage can appear up to 12 weeks after starting treatment, when patients may no longer be connecting new symptoms to a medication change made months earlier. For pregnant women, the benefits of methyl-dopa often outweigh the liver risks. But for others with hypertension, safer alternatives are usually available. If you're taking methyl-dopa, especially during pregnancy, be particularly vigilant about symptoms like unusual fatigue, nausea, or pain in the upper right abdomen. Reporting these symptoms promptly could prevent serious liver damage. But as concerning as methyl-dopa can be, our next category affects some of our most vulnerable patients. Number 2, antipsychotics. Mental health medications that menace your liver. For people with severe psychiatric conditions like schizophrenia, bipolar disorder, or treatment-resistant depression, antipsychotic medications can be transformative. Drugs like risperidone and clozapine can quiet tormenting voices and stabilize extreme mood swings. But while these medications help the brain, they can seriously harm the liver. Among antipsychotics, clozapine carries the highest liver risk. This medication, often reserved for patients who haven't responded to other treatments, can cause several types of liver injury. The most common is drug-induced cholestasis, where the flow of bile from the liver becomes restricted. When bile can't flow properly, it backs up into the liver, causing damage to the cells and potentially leading to jaundice. What makes antipsychotics particularly problematic from a liver perspective is that patients often can't simply stop taking them if problems arise. Abrupt discontinuation can trigger severe psychiatric symptoms, creating a difficult risk-benefit calculation. Additionally, many people taking antipsychotics have conditions that make it harder for them to recognize or report physical symptoms. Someone experiencing psychosis might not notice or mention the early signs of liver damage. Studies suggest that between 0.5 to 1% of patients taking clozapine will develop significant liver abnormalities. The risk appears highest during the first 18 weeks of treatment, but can occur at any time. If you or a loved one is taking an antipsychotic medication, regular liver function tests are essential, especially during the first few months of treatment. But as serious as these prescription medications can be, nothing compares to the damage caused by our number 1 liver destroyer. Number 1, acetaminophen, paracetamol, the over-the-counter killer. You probably guessed it. The medication most likely to send you into liver failure is sitting in nearly everyone's medicine cabinet. Acetaminophen, also known as paracetamol or Tylenol, is the leading cause of drug-induced liver failure worldwide. What makes acetaminophen particularly dangerous is its ubiquity and perceived safety. It's in hundreds of products. Not just pain relievers, but also cold medicines, sleep aids, and fever reducers. People often take multiple acetaminophen-containing products without realizing they're doubling or tripling their dose. At normal doses, acetaminophen is generally safe for most people. The problem occurs with taking just slightly more than the recommended dose, taking the recommended dose while consuming alcohol, taking the full dose when malnourished or fasting, taking it regularly for extended periods. When you take acetaminophen, your liver breaks it down into various compounds. One of these is highly toxic, but your liver normally neutralizes it with glutathione, a protective antioxidant. However, if you take too much acetaminophen, or your glutathione stores are depleted, which happens with alcohol use or malnutrition, this toxic compound accumulates and destroys liver cells. The terrifying thing about acetaminophen overdose is how quickly it can progress. Liver damage typically begins 1 to 3 days after taking too much, with symptoms appearing 2 to 4 days later. By the time many people seek medical help, their liver is already failing. Of all cases of acute liver failure attributed to medications, more than a third are due to acetaminophen. And once liver failure sets in, the mortality rate is high without a transplant. There is an antidote, N-acetylcysteine, also known as Mucomyst or Fluimucil, but it must be given within hours of the overdose to be most effective. The next time you reach for acetaminophen, remember that even this seemingly innocent medication can be deadly to your liver if misused. Now that you know the 10 medications most likely to damage your liver, here's what you need to do to protect yourself. Never exceed the recommended dose of any medication, especially acetaminophen. Be aware of combination products that might contain the same active ingredients. Limit alcohol consumption when taking medications. Know the early warning signs of liver damage. Get regular liver function tests if you're on any high-risk medication. Tell your doctor about all medications and supplements you're taking. Consider liver-supportive nutrients like milk thistle, N-acetylcysteine, and turmeric after consulting your doctor. Remember, your liver is remarkably resilient, and can regenerate if damage is caught early. But once cirrhosis develops or acute failure occurs, the options become limited. I've created a comprehensive guide to liver protection that goes beyond what I could cover in this video. You'll find a link to it in the description below. Your liver is your body's most important detoxification organ. Treat it with the respect it deserves. After all, you only get one, and no pill is worth losing it. If you found this information valuable, check out my video on the foods that heal your liver naturally for the perfect companion to this knowledge. Thanks for watching, and remember, knowledge is the best medicine.